A continuación, en Poder 97.1, tu hora informativa. Entrevistas e información para nuestra comunidad. Y ahora con ustedes, Ida Pérez.
Buenos días, mi gente de Rochester, y bienvenido a su hora informativa. Mi nombre es Ida Pérez y para mí es un verdadero placer poder estar con ustedes en esta mañana. Su hora informativa es un programa que les trae información importante que esperamos que los inspire a una mejor calidad de vida para usted y su familia. Cubrimos información sobre los campos de salud, educación, empleo, vivienda y muchos otros temas más que nos afectan como persona y como pueblo. Su hora informativa está aquí todos los sábados de 10 a 11 de la mañana y nos alegramos muchísimo de que estén con nosotros en el día de hoy. Hoy tengo una invitada que hacía tiempo que no me visitaba, estaba muy ocupada, cambiado de posición, han pasado muchas cosas en su vida. Y bueno, estaba bien ocupada, pero me alegró muchísimo de que haya sacado el tiempo para poder estar con nosotros en el día de hoy. Le voy a pedir a ella que se presente, que nos diga su nombre, de dónde eres originalmente y cuánto tiempo llevas aquí en Rochester.
Bueno, gracias por tenerme, Ida. Mi nombre es María Elena Velez de Brown. Soy la comisionada del Departamento de Salud Pública. La última vez que hablamos era la diputada.
Sí.
Así que gracias a Dios me han confirmado. He estado en Rochester desde el 2014 estudiando... sacándome la maestría de salud pública en la Universidad de Rochester y he trabajado en el Departamento de Salud Pública desde entonces como la diputada y ahora como la comisionada.
¿Cómo te sientes ahora como la comisionada? Porque es una responsabilidad mucho más grande.
Yep.
Un cambio, me imagino, que para ti, ¿verdad? Sí. ¿Cómo lo has logrado? ¿Cómo has podido hacer esa transición?
Bueno, fue una transición que no lo esperaba tan rápido, pero el Señor da gracia, ¿verdad? Así que es un orgullo ser la primera mujer, la primera hispana en tener esta posición, y también es mucha responsabilidad, pero también me da un poquito más libertad de llevar el departamento en una dirección donde yo quisiera ir. Yo ahora puedo escoger los temas en la cual nos vamos a enfocar y vamos a hablar acerca de uno muy importante hoy, pero también me da un poquito de terror a veces porque es mucha responsabilidad.
Sí. ¿Qué ha sido lo más difícil para ti en esta transición? Hasta este momento, ¿verdad?
Lo más difícil ha sido no tener una diputada. Yo no sabía mi valor hasta que no tenía una yo que me ayudara con todo este trabajo.
Claro.
Anteriormente había un comisionado y una diputada, y así que ahora todo cae sobre mí. Y desafortunadamente eso quiere decir que tengo que tomar bastante tiempo, más tiempo fuera de mi hogar. A veces hay reuniones por la tarde o eventos fines de semana donde ya no puedo dividirlo con otra persona.
Sí, pero ¿piensan coger otra diputada?
La posición está abierta. ¿Alguna persona conoce un doctor, un médico que tiene la maestría en salud pública, o un médico que tiene el certificado en la medicina preventiva y salud pública? Por favor, que me llamen, que me manden el nombre, que le manden a meter una aplicación.
Sí, claro. Y we have another guest, and I'm assuming you do not speak Spanish.
I do not.
Okay, all right. So I'm going to ask you to introduce yourself, to tell us who you are, where you're originally from, and how long you've been here in Rochester.
Sure. My name's Megan McDermott. I joined the health department back in October. Before that, I was working for the communications department for the county downtown. Okay. I'm now the chief community engagement officer for the health department. And prior to that, I was an investigative reporter with the Democrat and Chronicle for 20 years.
Oh, nice.
I grew up in Chilai, and I've lived in the Rochester area all my life.
Okay. And where are your parents originally from?
Maine.
Maine, okay. And what brought them here to Rochester?
My father used to be the manager of a store called Anderson Little at the Greasetown Mall. He sold men's clothing.
Okay, nice. Yeah, I always like to ask that question because, people often complain about Rochester. They're like, I'm ready to leave Rochester, but then so many other people come and make it their home, right? And
it's a wonderful community.
Yeah, it is. I agree it is, and people need to stop complaining about it.
I agree.
That's my opinion on it, right? So Mari, tell us, what are we going to be talking about today?
We're here today to talk about the opioid epidemic. And as you know, as I've said before in many places, the opioid substance use disorder or addiction is a disease. It's a brain-based disorder. It's not a moral failing. It's not someone's just making bad choices. When people try or experiment with specific substances, some people are going to have a change in their brain that's going to make them very likely to go down this path of use and then misuse, and then that can develop into a dependence where your body and your brain needs to have this substance, whether it's opioids or coffee or caffeine or methamphetamines. Or if you don't have that, then your body starts to feel really terrible and go into something we call withdrawal. And so that leads people to behave in ways that they never would otherwise. It leads people to spend their children's savings accounts and steal from loved ones and break into neighbors' homes and cause all kind of damage because they are in such physical and emotional pain from being in withdrawal. And so I'm here to talk about a lot of work that my team is doing to try to address and help folks that are in active substance use get into a recovery and be able to reclaim their lives, and also how we can prevent folks from developing a substance use disorder in the first place.
Why do you think the number has gone so high? Because this was something that, maybe, 20 years ago, you would not see as much, right? And then all of a sudden, our neighborhoods are infested with it. We see a lot of people, unfortunately, a lot of the homeless people are also, users. And so, that's how they end up becoming homeless, right? Because whatever addiction they have brought them to that point. And it's something that, as a resident, and I think you and I have had some of these conversations in the past of how hurtful it is, too, for residents, right?
Yeah, for the non-users.
For the non-users. So it's not just the users that suffer, but I feel like, there's some trauma for myself based on what I've seen in my neighborhood, people actually shooting up or people overdosing. The amount that we've had happen within a short radius around my neighborhood, is very traumatic at least for me as a person, and as a citizen, right? And as a person that doesn't use, sometimes it's hard to understand, why are they doing this? Why are they doing this to themselves, and why are they doing this to me? So it's really hard.
It is very, very hard. I would say substance use disorder has been around forever. It's gotten more public with the type of substances that are available. And so, a lot of folks might say, I smoked some marijuana, smoked some weed in the 70s or 80s, and I didn't end up, into a whole life of substance use disorder. The substances available today are so much stronger. Hopefully folks have heard of the term fentanyl. And so that's a really, really powerful synthetic opioid that didn't used to exist before. And so it takes so very little of that drug to either get someone hooked and certainly to cause an overdose that we're seeing much more frequent negative consequences, like people overdosing, like people getting hooked really, really quickly compared to years past. And certainly in the specific locations where people use, it's totally dictated by policies around policing, policies around where are the neighborhoods that have not been invested in, so neighborhoods that have concentrated poverty and maybe less hope, less options. Young people start being raised around communities where they don't see an alternative. What they see is maybe more criminal behavior. Maybe they start to see more folks using and think there's no other alternative. And so a lot of those kind of social factors will dictate where people are going to be able to buy. And certainly because of the disease of addiction, some folks are going to have to buy and use really quickly. So they're not going to be able to buy it and take it home because they're already in such bad withdrawal. And so that's going to lead to the things that we've talked about before, the needle litter, all of the paraphernalia that ends up in parks and in people's front yards. And so that is mostly dictated by historical practices and policies that make it, that drive the the drug market to
Yeah.
specific areas.
Yeah. I know there's been a lot of documentary around pharmacies, wanting to sell, wanting this, to sell these medications. We've heard, and I don't know how much study you guys have had and how much data you have on how many of these people actually started from an injury, right, to take these medication for pain, and then
Right.
it turned into an addiction.
Sure.
I know that in 2017 in this neighborhood, we did a detail on through a grant that we got through Ibero to do what we call Project Clean. It was community and law enforcement and some other people from the health department, other places like Trillium. They kind of got together to see, okay, what's really happening, like how is this impacting all of us. And one of the things we discovered was that a lot of the people weren't people from the neighborhood, but people came to the neighborhood to buy the
to
drugs
buy
and
and
kind of
take.
stayed close to it. We also discovered that a lot of those people were Caucasian people. They weren't even, the people from the neighborhood. So,
Right, right.
do you
So we
still
have-
have a lot of
we have
data,
data
of that?
around
And
that.
what can
Yep.
you update us with that?
Yeah, so the majority of the population of Monroe County is white, right? 70%.
Right,
So there's going to be a lot of white folks that are impacted by
Yeah.
substance use disorder. Opioid overdoses specifically tends to hit men much more so than women, not exclusively, but
Right.
like 70% of, almost 75% of the overdose deaths in our last report were in men compared to women. And so there are going to be a lot of folks who are not Hispanic, who maybe weren't raised in the neighborhood, that do come and
Yeah.
find and buy and use locally. But what we also found was that there are a disproportionately high number of older Black men and older Latino men who are dying of overdoses. And what I mean by that is if there's only 16% of folks in Monroe County who on a census will check the box, I'm African American, if everything was equal, we should see 16% of overdose deaths should be in African American men, but we don't. The number's like 30 or 40%. And so it's unusually high for Black older men, for older Latinos. And so there is, yes, just because of the sheer numbers, it's a lot of white folks, white men that are dying. But there are more African American, more Latino men who are dying than they should, all things being equal. And again, we think back to what we call the social drivers of health, right? Who is least likely to have educational opportunities that allow them the opportunity to get better paying jobs so that when stress hits, they have the resources to deal with fixing the car or doing whatever
Right.
they need to do, right? You add all of these different stressors of poverty and racism and discrimination and trauma that happens in more at higher rates in specific neighborhoods. And if people don't have the resources to get the help they need, to get the counseling, to
Yeah.
heal from their childhood traumas, well, those folks are much more likely to start self-medicating and treating their trauma with substances, whether we start with alcohol, you start with marijuana, and move to
Right.
other substances that are more readily available in some
Yeah.
places.
Yeah. So what are some of the things that the county is doing to kind of help with this,
address
right?
this,
Because
yep.
I hear a lot of programs, I hear a lot of people talking about outreach and, we're doing this, we're doing that, but it doesn't seem to get any better. So,
Right.
what kind of impacts are these programs really having?
Yeah, so that's two different questions. So I'll answer the first one first about what are we doing, right? So we have an addiction services division now in my department. We're using opioid settlement dollars from those pharmaceutical companies to have teams that can go out and offer Narcan or naloxone. That's that nasal spray medicine that
Yeah.
people can get for completely free. And if you give that to someone who's having an overdose from an opioid, well, then that can help someone start breathing again. Because opioids, yes, they treat pain receptors in your brain, but they also hit the parts of your brain that control your breathing, and they slow it down until people stop breathing, and that's how they die. And so if you give someone Narcan, well, then that's how you can save someone's life. And so we've put up more than 550 Nalox boxes. So these are, it's like an AED box all over the community, in businesses and libraries, in all of the county buildings, where if somebody's having an overdose, there's no lock, there's no code, just open the door, grab a kit, and you can use it. People can take it and have one for their loved one. People can have it for themselves. And so if we can flood the community with this life-saving resource, that can give a person who is actively using one more chance to get into treatment, to get connected to a chemical dependency program where they can start to get medication to treat the physical withdrawal and also the counseling they need to address their trauma. And those two things combined are the strongest thing that can help someone get into a stable recovery. So we're doing a lot of that. We have outreach to people who survive an overdose, and my team goes out and offers them, hey, you just had an overdose. Are you ready to go to treatment? Do you need a ride? Do you need the phone number to get the evaluation that you need to decide what level of care you qualify for? Things like that. But we're also doing a lot of work to try to prevent people from developing a substance use in the first place. So we're finally getting some high schools to allow my staff to go in and educate, whether that's in a health class or in some other setting. And some of my team have lived experiences. They were someone who was using substances, and now they're in recovery. And so they can speak to kids and tell them, hey, this is what experimenting or using drugs can lead to, and this is how hard it is to get into recovery. And so they can talk about it in a way that maybe you or I can't if we haven't had that experience. We're also working with a lot of colleges and universities. Same thing. Get Narcan into the resident assistants and the dormitories. Get them into the Greek houses and sororities, fraternities, where people might be throwing those crazy parties. There might be some substances there. So, okay, while people are still, developing that front part of their brain and thinking better about long-term consequences, let's protect them. Let's give them this harm reduction strategy so that they don't die and that they can live to survive, to get counseling and make better choices. And then something that we really want to focus on, and what I'd love to do more of, is to really think about how do we change the environment, right? How do we give these older Black and Hispanic men an alternative to using substances, right? That has to do with employment. That has to do with providing stable housing. That has to do with getting mental health supports to some of those homeless folks that you mentioned, because it's not all substance use. If you have untreated schizophrenia, bipolar disorder, then it's going to be very hard for you to keep your life stable, and it's going to be much easier to turn to substances. And so that is collaborating with our Office of Mental Health. And again, with the schools, screening kids, talking to some of our health systems to make sure that they're offering the supports that folks need to get treatment for these other conditions that can sometimes predispose you to use substances. So there's a lot of different things that we're doing, and there are other things that individuals can do as well.
What about treatment? Because I often hear there's not enough beds, there's not enough this, there's not enough that. Like, how truth is that, and
So-
why some people find it to be so difficult to find treatment?
And so,
Like, are we missing something?
there is a disconnect, because when I speak to my colleague April Aycock, she's the head of the Office of Mental Health in the Department of Human Services for the county. She is in contact with all of our chemical dependency treatment providers, and there are beds and there are spaces in programs that are available. Sometimes folks don't qualify for inpatient treatment. That might be what they want, but that is not what they have this whole screening algorithm to decide who can do outpatient, who can do like a partial day program, and who really needs detox. And so a lot of folks may misunderstand what it is that they qualify for to get treatment.
So what would be the difference between one and the other?
Well, detox would have to do with, how recently did you use, how deeply is someone in their withdrawal. And I'm not a mental health provider. I'm a regular medical physician, so I don't know all the details. But I do know that there are different levels of symptoms that you have to have in order to meet criteria to be admitted. And part of this is just insurance is willing to pay or not, which is unfortunate. And so what folks can do is the Office of Mental Health has created this really, really useful app that folks can download to their smartphone, which has phone numbers for different resources to address all kinds of mental health conditions. It's not just opioids. They've got the phone numbers for crisis mental health lines if you've got a youth who's suicidal. So anybody can download that app for free. It doesn't send data to anybody, but it also just gives some suggestions for life is stressful. How do you use mindfulness? How do you meditate? How do you use other strategies to deal with life when it gets hard, as compared to turning to alcohol or some other substance? But there are treatment options, but sometimes, we'll be fully transparent, there aren't enough providers that look like some of the community members who need help. So then we get into thinking about linguistic and culturally appropriate care. And so there's a difference between having a counselor that you talk to through an interpreter, if you're lucky, in the room, but what does that do to kind of the dynamic of now there's this third person, or on the phone. It's better than nothing, but it's not great to still have this intermediary. And so, especially when we think about the data indicating that older Black men who think they're using cocaine are dying of opioids, because we know that all illegal drugs nowadays are contaminated. They're tainted with fentanyl. So someone can think they're buying cocaine or meth, and really it's got an opioid in it. And if that's not what I was trying to use, I might not be prepared and have Narcan on hand. So then I'm at high risk of overdosing then. But how many programs are being created specifically tailored to the needs of older Black men? And when I say older, I mean like 40s, 50s, 60s, 70-year-olds, right? There are people that have been using cocaine for a long time, and they know how much cocaine they can tolerate, but not when it's got fentanyl mixed in it. So, how are we providing for the needs of that population as well?
Yeah. With the Narcans being, these boxes, and I mean, how did people take that? Like, I know you probably went to a lot of businesses, libraries, you said, a whole lot of other places. How was that received? Like, were people like, I don't know if I want this?
Yeah,
or
sometimes. And so
how was that received?
It's funny you should ask that, because we have a public service campaign that started in the fall, where we interviewed a number of the different businesses that accepted the boxes. And the way we approached it is we received data about the locations of all the overdoses in the county, and then we went to the businesses on those corners, on those streets, that said, look, in the past month, week, we have received reports of this many overdoses. Would you like to have something in your business, on the outside of your business, or wherever that people will let us put it up, that can save these lives? And so some folks take a little convincing. Some folks were like all over it. Maybe they had some family members, lived experiences, and were like, yes, this is something that we need. And some folks just wanted to be a good neighbor to the rest of the community. Like, I don't have anybody in my family that we know of, but most of us have somebody in our family who's struggling with something, even if it's not opioids. But they were willing to take it, and we received so much feedback, like, wow, you put up the box, and the next day there was someone in the back alley, or a week later someone came running in. There's somebody stopped breathing. Here's the box, go, take it. And so we've gotten a lot of really good reports. And unfortunately, the folks that are a little more hesitant, it's very common still to have this stigma around mental health disorders in general, and then substance use disorders specifically. So we're also doing work around that. So the team has created a survey that we want to deploy and use. We're going to start with law enforcement, because there's unfortunately some research data that says that it is easy to get burnt out when you're an emergency first responder. You show up over and over and over, and the same person. Why don't they stop using it? Well, because it's a brain disease, right? We don't ask a diabetic, why does your sugar keep going crazy, right? It's a physiological problem. And so we're going to deploy a survey of new recruits or cadets in the academy, and my team wants to just see what are people's beliefs, what do they think they know about substance use disorder, and then how can we come and educate them when they're learning about how do you interact with someone in a mental health crisis, right? Because law enforcement, they're just as likely to show up as an ambulance, and so they need to be trained. How do we interact and support people and try to avoid some of the really, really awful outcomes that we've had happen in this community when emergency responders show up to a mental health crisis? And so we're doing a lot of work around trying to combat that stigma, but it's still there, and it's really just a lack of education.
Yeah. I remember in 2017, 15, 16, 17, 18, around there, when we were working with Project Clean, I myself had a very hard time with it. I think because I was seeing so much of it. I mean, it got to the point where I knew if I would hear the fire department like I already knew, based on their siren, what they were coming for. Like I already knew there was an overdose, right? I mean, that's how bad it was.
Often. Yeah.
It really got to me emotionally and spiritually. Like it really got to me to the point, and I hate to admit this, but it's true. And I really need people to understand that it does do something to your brain as well, right?
Sure.
Because I consider myself a very caring, loving person, right? And I would never do harm to anyone. And I would definitely come to the rescue if someone was to be in trouble, right? But it got to the point where I was like, I don't care how they leave.
I just want them gone.
I just want them gone.
Right.
I don't care if they go in an ambulance. I don't care if they have to carry them out. Like, I just don't care. And I remember battling with the fact of, did I want to be Narcan trained or not? Do I really want to be the one out there saving this person's life when I don't even want them in my neighborhood?
Yeah.
Like, that was really, really hard because I was like, oh my God, my heart has changed.
Well, and so that happens when you get repeated exposure over. That's that trauma for
I was
bystander.
exhausted of the whole situation, like all the way around, because we had the drug dealers, then we had the users, then we had the people giving them Narcan and helping them stay there, right? And then we had the police, and then we had the ambulance, and then it was just, and then we were picking up thousands. I could not walk outside of my house without a bucket for needles and a picker, and I couldn't enjoy the trees. I couldn't enjoy the sky. I couldn't enjoy the birds because I couldn't even look up. I had to look down the whole time when I'm walking to make sure that I wasn't going to step on a needle or come across something. You know what I mean? It was so bad that it literally changed me as a person.
Right.
And I had to come to grips with that. I really had to come to grips with that. And just real quick short story that happened. One day I came out and there was a young lady in front of my house shooting up. And I knocked on her window and I said, you need to get out of here. Like, get out of here. I don't want you here doing that here. And I remember her looking up at me and she took off, right? About a year later, and we did a no mas. We did a no mas demonstration for, kind of interrupting what was happening in our neighborhood. So we would just stand in front of places where they would sell drugs and stuff, and we would just interrupt their business for, even if it was just for an hour, but we interrupt it, right? We figure, okay, and in that hour, nobody's going to buy, nobody's going to die, nothing's going to happen within that hour while we're there. And I remember there was a group of Nazareth students that came and stood with us. And then afterwards, we went into St. Michael's and we had coffee and hot chocolate and whatever for the people because it was cold. It was during the wintertime. And a young lady comes up to me and she says, you're the lady that lives on Scranton Street, aren't you? And I said, yeah. And she was like, you don't remember me? I was like, I have no idea. Like, no, I don't know. I don't know who you are. She said, I was shooting up one day in front of your house and you knocked on my window and you told me to get out of your neighborhood, not to do that there. So I was kind of like, whoa, right? Like it kind of shocked me. Yeah. And she said to me, I drove away and I really thought about what you said. And I really thought about why am I in this woman's neighborhood shooting up when I don't belong here?
Right.
Like I'm not supposed to be here.
I'm not supposed to be doing this at all, no matter here or anywhere else.
And she said, and from that day forward, I decided that I wanted to clean myself up.
Wow. That's
and
powerful.
I did, and now I'm in Nazareth. I'm in my second, she said she was like in her second semester or something. And she said, had you not done that, I probably still would have been there.
Yeah.
And that's what kind of shifted back my brain and my heart to say, okay, Ida, you cannot have this attitude. You cannot, let them die if you see them dying over and over. And then I got Narcan trained after that, and I carried one in my car. And, it just really, because, I was able to really put the human face to the situation.
And realize that recovery is possible, because sometimes it feels like you see it day in and day out and it's never going to change.
Right.
But at the individual level, it can change. Yeah. And so if people are ready for a change or you want to give a resource to somebody in your family, anybody in the entire county, we've had calls from Puerto Rico, for crying out loud, to our our Addiction Services Impact Team 24/7 hotline. So folks can call 585-753-5300 and get connected to members of my team that can, talk them off the ledge. Like, I've been sober, but I'm so tempted to relapse. Okay, we got folks that can connect you to a counselor. People can ask for when is the next scheduled Narcan training. If you have, your business wants to get a nalox box, you can call that same number. If folks want to host a training at St. Michael's or wherever, the team will do that. That could call that number, 585-753-5300, because they want to give hope. And so that's why the team goes out and walks down Lyle Avenue and Goodman and North Clinton and, just give people hope. Do you need Narcan? Are you ready to get connected? We had a story of a woman, the caller from Puerto Rico. Her brother was here and she heard that he relapsed and she was just looking for resources and found our number. And so she gave them his information, where he was living the last time she knew, so that they could go out and connect with him and offer him hope. Because sometimes people start down this road of substance use disorder and it changes the way you think. It changes your brain chemistry. And some people really feel like there is no way out anymore. And sometimes they just got to see that actually there is. Hey, here's my team. I used to have this, I was in your shoes and now I have been able to get my life back together. And it's possible. But it often takes a long time. It takes repeated efforts. And, you can be in recovery and then relapse happens. It's the same. I always use the example of someone with diabetes. You could catch a cold and your blood sugar can spike or it can drop. And that doesn't make you a bad person. That doesn't mean you're not taking your medications. It doesn't mean you're not doing what you're supposed to do. Life happens. But if we can empower everyone to know that there's hope, if we can empower the people around that patient, like, hey, okay, fine, maybe you fell off the wagon, but you don't have to stay there. Let's get you back connected or with a peer or whatever. There are options.
Yeah, but this young lady definitely, she said that I changed her life. But in reality, she really changed mine. Because then I just started looking at it in a different way. I didn't have all the stigma. I really started looking at it again and I think I remember you doing a presentation, One at Heart and Soul, when you talked about the brain and really thinking about it as an illness and not, these people are doing this because they want, like, it really, and I'm a smart person, but it was so overwhelming. That it just kind of consumed my life. And I was just like, I just want this to go away. But then I was able to look at it in a different way and have a little more compassion and, a little more understanding and, not being so against the Narcan boxes being put in our neighborhood, because there was so many different things ideas that people were coming up with. And I was like, I don't know if I want that in my neighborhood. I don't know if I want that. I don't know if I want to see that. I don't know if I want to support that. So definitely thinking more about it and trying to see it in their perspective, right? What is it that they need?
I will say the data are very clear. We put nalox boxes where overdoses are happening. So we don't put boxes and air quotes here, those people then come. Those people are your neighbors and maybe your employees or your boss or your partner or your child. They're already here in every area, right? Because substance use disorder does not discriminate. We see overdoses in every town, in every socioeconomic status, every class, every race. Some people are more impacted than others, but anybody can develop a substance use disorder. And so that's why everybody should be Narcan trained so that you can be prepared to save a life, whether it's someone you know and love closely, intimately, or the stranger on the street in the car.
So what are you going to be doing exactly with high school students and colleges, students, in helping? Because I think, prevention is always the best way to go, right? Like we wouldn't have half of this stuff happening if there was more in prevention. And I think, and I'm even thinking about early childhood, where I'm an early childhood person. That's my background. I teach a CDA class, which is a Child Development Associates class. And one of the things that I talk to my students a lot is about kids' resilience, right? Resilience, grit, being able to overcome things, and how do we help kids develop those coping skills, right?
Sure,
That it's
sure.
not the, just because, so-and-so didn't want to play with you, it's not the end of the world, right?
Right.
Type of thing. And how do we model that, right? How do we as educators model that? But then how do we help parents model that? So I'm thinking, but what exactly do you plan to do with, what would that look like? Is there a curriculum that you're going to be following, and what would that look like for students?
Yeah, so for it varies depending on the partner we're working with, right? So we offer all the supports we can, and people take us up on different degrees of it. So if a college or university doesn't have Narcan yet, they totally should, and we can provide it, right? We can work through your health services and provide it that way. We can work through your housing system, so get Narcan in all of the dormitories.
Yeah.
We can work through, we do a lot of presentations to schools of nursing and pharmacy, and so all of those people that are training to be the helpers and the healthcare professionals, we will give you Narcan training, and in that training, we talk about the brain basis of this disorder, so we can try to avoid some of that stigma, because the last thing you need is for someone to say, I'm ready to go get help, I'm going to go to the emergency department, and someone's going to use language like this junkie or this druggie, like if you hear that and you receive that stigma when you're trying to get help, it's so easy for people to fall right back into it and like, okay, well, there's no hope. Even these people that were supposed to help me aren't going to help me, or they're going to do it in this, very judgmental way. So there's that aspect of it. But then when you mention the early childhood, we have not specifically delved into that area. It's, you can imagine, it would be very touchy for parents to feel like, why are you talking to my kid about addiction? And what we really need to do at that age, as you mentioned, is yes, build resiliency, but also how do we protect kids from having to be resilient in the first place, right? How do we make sure no kid is hungry? How do we address teaching parenting classes so that we can, some of us that were maybe raised in a more authoritarian way can stop re-traumatizing our children and learn different disciplinary techniques that maybe aren't quite so physical, that could
more
lean
guidance
into
than
the
discipline,
kind of abuse and those kinds of things. And so changing the environment around these children can make it unnecessary for them to be quite so resilient, but also, yes, there does need to be education about, you can do hard things, and hard things are going to happen to you, but you don't have to just run away from those hard things, because that's what people do, is they escape into substance use or other things. And so how do we teach people to name their emotions, and what are healthy ways to
which is the
address
best
them?
way with young children.
Yeah, and there's other things, like if you were only ever raised on Scranton now around this environment, well, how do we take kids out of there and expose them to nature and to, there's an Equicenter in Mendon Parks, which is only 45 minutes away, but can feel like a lifetime away I'm from North Philly. Some of the people that I was raised with ended up in these addictions because they never got out. They were never exposed to anything different. So how do we think as a society, how do we show people that there's an alternative?
I'm thinking about, some of the high school students that, live perhaps in, let's say, for example, in my neighborhood, because there's a lot of them all over the city, but, that see this day in, day out, may have someone in their family already that is in addiction. I've had people that have experienced their uncle coming and stealing everything in the house to sell it, to be able to, so they're not the ones in it. Maybe their parents are not the ones using, but they have a family member that comes, and because of their addiction, it affects that household, right? So I'm assuming that, some of this education would be coping with that. That it's not you necessarily, but someone in your family.
Sure.
And how do you still love this person, right? Because they are your uncle. They may be your mother or father's brother. You still love them as an uncle. But how do you set healthy boundaries? How do you not get sucked into that? Just all these things that I can imagine go through, kids' heads when they're dealing with this kind of stuff.
Yeah, and so we have not designed those curriculum specifically. I know they exist. I have seen them. And certainly I'm glad that the majority of the school districts and superintendents, they're very well aware of these issues, that kids are just seeing so much more. So they're adding a focus on the social emotional learning in a way that certainly wasn't there when I was going through school, when I was in those early development programs. So that's an important component as well.
Yeah,
I agree.
Yeah, Mari, we've talked a lot about what you're planning to do with specifically with opioid. Can we do a short summary of some of that in Spanish for our Spanish speaking, because we kind of went into English and forgot to go back into Spanish.
To go back and forth, yeah.
But that's fine, because you're good at the Spanish language, so I know you'll be able to do some summary for us.
So, revisar toda esa conversación en español.
Bueno, un resumen. Obviamente no podemos decir palabra por palabra, pero definitivamente un resumen, porque creo que es bien importante, ¿verdad? Que las personas sepan cuál es tu misión ahora en tu nueva posición cuando se trata de este tema en particular.
So hay dos partes del trabajo. La primera es la prevención, eso es lo mejor, ¿verdad? Claro. Trabajar con las escuelas superiores, con las universidades, los colegios, para enseñar, para traer el personal de mi departamento para que enseñen y hablen y expliquen, estas son las consecuencias de experimentar, de usar estas sustancias. Cualquier persona puede desarrollar el trastorno de uso de sustancias y estos son las consecuencias, y esto es lo difícil que es salir de esa vida y entrar en una recuperación estable, ¿verdad? Así que tener esa prevención, y entonces después de que una persona ya está usando, está adicto, ha pasado por el uso y entonces la dependencia, que ha cambiado el cerebro, el cuerpo de la persona y que está demandando que le den esa sustancia o sientan todos esos síntomas, entonces es importante entonces poder traerle los recursos de lo que se llama en inglés harm reduction strategies, o estrategias para reducir el daño que hace. El primero es Narcan o la naloxona, así que esa es una medicina que se mete en la nariz y puede cambiar o prevenir una muerte de sobredosis. Y es importante que todo el mundo sepa cómo usarlo, que lo tenga, y que si uno tiene un negocio, que nosotros le podemos entregar una caja donde uno puede tener ese recurso gratis para toda la comunidad, ¿verdad? Porque una persona puede estar sentado, como usted dijo, sentados en la escalera de la casa o donde sea, y puede experimentar una sobredosis. Así que tener ese recurso donde cualquier persona puede rescatar a esa persona y darle una oportunidad más de entrar en tratamiento y poder recuperar su vida. Ahora tenemos personal que están yendo específicamente para trabajar con una persona que ha sobrevivido una sobredosis y ofrecerle conexión con tratamiento, a ver si están listos para que le lleven, ofrecerle transportación para que puedan entrar en una recuperación. Hay que hacerle una serie de preguntas para saber cuál nivel de tratamiento ellos pueden recibir. Así que si alguien tiene alguna pregunta acerca de cómo recibir ese entrenamiento, si alguien tiene un ser querido que tiene el trastorno y quiere conectarlos con mi equipo, pueden llamar al 585-753-5300. Ese es un número 24 horas, 7 días a la semana, donde hay alguien en vivo que le puede ayudar a buscar recursos, a entrenarse en Narcan o la naloxona. Y más que nada también tenemos que pensar al nivel de la sociedad, cómo es que podemos disminuir todos los problemas que llevan a una persona a empezar a usar las sustancias. Si es la pobreza, si es la falta de educación, si es falta de empleo o
salud
de oportunidades,
mental.
la salud mental. Así que todos estos otros fuerzas poderosas pueden empujar a una persona que empiece a experimentar o a usar sustancias y empezar a bajar hasta que llegue al punto de tener una adicción. Pero es trabajar a ese nivel requiere toda la comunidad entera, que nosotros todos pensemos en cómo podemos proteger a los jóvenes para que no tienen que experimentar ese nivel de estrés, de la pobreza, de hambre, de no tener vivienda. Porque entonces, cuando uno tiene tanto estrés a una edad tan joven, a veces esas son las personas que tienen más alto riesgo de tratar de usar sustancias para escapar de esa realidad. Así que si podemos cambiar esa realidad, entonces estamos protegiendo a los jóvenes, y también hay que enseñarles cuáles son maneras mejores de manejar ese estrés. Porque la vida va a suceder algo, pero cómo podemos empoderarlos para usar el ejercicio, o estar fuera en la naturaleza, o la oración, meditación, lo que sea, cualquier cosa que no sea usar una sustancia para poder bregar con todas esas emociones y el estrés de la vida.
Háblanos un poquito de lo que dijiste en cuestión de los hombres afroamericanos y latinos mayores de edad que tienden a ser...
Desafortunadamente, el último reporte de la oficina del examinador médico mostró que aunque 70% de la población del condado de Monroe es caucásico, hay un grupo de hombres, la mayoría hombres mayores, que están muriendo desproporcionadamente de sobredosis. Esos son afroamericanos mayores de 40, 50, 60 años y también hispanos mayores 50, 60, 70 años, quienes están muriendo más de lo que se espera en cuanto a la población, a la parte de la población que ellos forman. Y eso se cree, nosotros pensamos que tiene que ver con el hecho de que hay un grupo de la población que ha estado usando la cocaína crónicamente, pero sabemos que todas las drogas están contaminadas con el fentanilo. El fentanilo es un opioide sintético, pero súper poderoso. Así que una persona que está comprando la cocaína o metanfetamina, si ellos piensan que eso es lo que están usando, puede ser que no se preparen, no van a tener la naloxona y entonces caen bajo una sobredosis y no tienen la medicina para cambiarlo. Y desafortunadamente estamos viendo esa realidad en los números de muertes por sobredosis.
Dinos un poquito, porque he oído, ¿verdad? No sé, porque lo he oído en la calle, cuando una persona que quizá usó y se ve en este estado como de, no sé, como momia, como se ponen de una posición y así se quedan por hora. Y he oído que le están metiendo un tranquilizador o algo que utilizan para los caballos. Háblanos un poquito de eso, porque eso me intrigó bastante, y ver las personas en el estado en que están, o se ponen como momias o se vuelven como locos, no sé, es algo diferente. Definitivamente no es lo normal que vemos cuando una persona se inyecta y utiliza algo. Es un estado bien diferente.
Depende de la droga, ¿verdad? Si uno toma un opioide, se supone que eso le calme a la persona. Y también funciona en los centros respiratorios del cerebro, y eso es lo que causa la sobredosis. Pero xylazine es otra droga que los traficantes le están metiendo a lo que sea, y eso también ¿Y
para qué se usa eso en sí? ¿Para qué esa medicina?
Se usa en caballos para tranquilizarlos o en los animales, pero se le mete, I don't know, no sé cómo se siente usar esa sustancia, pero si eso también puede calmar a una persona que tiene las mismas células que tiene un caballo, puede ser que eso ayuda con la sensación de usar las drogas. Porque mucha gente, le digo que si uno tiene una trauma, algo terrible que le sucede en la vida y no tiene el apoyo de un consejero para bregar con ese trauma, entonces a veces quieren dejar de sentir todo eso. Es un escape. Así que si hay algo que puede calmar y tranquilizar todo el ruido que uno tiene en la cabeza por un asalto o lo que sea, ¿por qué no escapar de esa manera si la realidad es tan difícil y uno no tiene los recursos para bregar con la vida, con ese trauma? Me imagino que ayuda con la sensación del high.
I want to ask in English because, I've heard people say, we've seen people in these very unusual state of mind. Either they're like a zombie where they're kind of like in a position and can stay there for hours in that position, or, not so long I remember seeing this guy outside my window just kind of just punching his chest and screaming, at the top of his lungs, and he was just totally out of it. And I've heard that they're using some kind of animal or horse tranquilizer that they're putting into the drugs.
Xylazine.
So, and that's the result of that. So tell us a little bit about that.
The person's reaction, what you see, is going to depend on what substance they took. And so xylazine is an animal tranquilizer that someone decided to put in some drug. And if we back up and think about maybe someone who's had a terrible thing happen, a rape, an assault,
Right.
and if it happens, some kind of trauma, if you don't have the support, the mental health counseling, maybe some medication to treat, the depression and the anxiety that comes from that, and you turn to substances, sometimes people are using these or seeking out these drugs just to calm down the noise and the madness that's going on in their heads. If you don't have healthy ways of managing that stress, sometimes you just don't want to feel anything at all. So if this horse tranquilizer will help calm you down for a little while, that might be why some people use. The really escalated behaviors, those might be some different different drugs that people use. But yeah, we know that xylazine is in our community. It's in the drug supply as well. And, people, whatever they may say they're selling you, everybody should assume it's contaminated with opioids at least, and just watch out, it might have xylazine in it too. So our team can give out some xylazine test strips, some ways that you can test the drugs to see, what am I actually taking? If I am in such withdrawal, I have to take something, that's at least another step you can take to protect yourself, to see what is it that I'm actually about to consume.
And I also heard that it causes some very ugly
Ulcers
and sores on their arms and stuff. So it does have, other effects.
Physical effects on the body.
Physical effects in the body that it's pretty, I've seen it, it's pretty alarming. The way
The
that
problem is they
looks.
don't heal very easily, very quickly. And so that leads to risk of infections and other problems.
So, estaba diciendo en inglés que también tengo entendido que las personas que toman eso les salen una úlcera bien fea en los cuerpos.
Y es difícil, a veces esas heridas no se curan rápidamente, y ahora eso ofrece la oportunidad para infecciones y otros problemas físicos en cuanto a la salud.
Lo cual es difícil, ¿verdad? Porque si uno se topa con alguien que quizás necesite ayuda y le ve todo eso en el cuerpo, quizás no lo quiera tocar, que se complica, todo se complica. Pero lo importante de eso es que las personas, ¿verdad?, que usan, que tienen su adicción, que se creen que están comprando un producto, hoy en día no se sabe lo que ese producto esté mezclado.
Y nuestro equipo puede entregar unas pruebas que uno puede usar, uno puede probar un poquito de la droga para saber qué es lo que contiene. Y entonces decidir, voy a usar o no, voy a usar un poquito menos, porque no se sabe exactamente qué proporción de lo que uno se va a consumir es la droga que uno quiere o el fentanilo o xylazine.
Mari, me acuerdo una vez en una presentación tú hablaste de qué pasa en el cerebro cuando una persona está limpio, ¿verdad? Cuando una persona decide ir en recuperación y de momento cae de nuevo,
recaída,
y que lo que pasa en el cerebro. Porque siempre encontré esto bien interesante.
Cuando estamos hablando acerca de opioides, el cuerpo se acostumbra, y entonces uno puede desarrollar lo que se llama tolerancia. Uno empieza usando 5 miligramos y eso es suficiente para controlar el dolor. Pero entonces el cuerpo se ajusta, se acostumbra, y entonces necesitan 10 miligramos, digamos, de la medicina para controlar el mismo nivel de dolor. Y uno sigue aumentando hasta que puede llegar al punto donde uno llega a la sobredosis. Si uno entra en tratamiento, el cuerpo no se queda con esa tolerancia alta, el cuerpo regresa a la normalidad. Pero si una persona entonces tiene la recaída y usa de nuevo, ellos tienden a usar la última cantidad que usaban, pero el cuerpo ya no puede tolerar esa cantidad, y eso lo mete inmediatamente una sobredosis. Eso le sucede a la gente que están o se mete en incarcerated.
En la cárcel.
En la cárcel, thank you. Eso es súper, súper común, que una persona está encarcelado, sale, y si ahora se le hace aún más difícil encontrar dónde vivir, el trabajo, y regresan a los mismos amigos, el mismo ambiente, y entonces van a ver una recaída. Entonces ese individuo tiene alta riesgo de padecer de una sobredosis.
Yeah.
Porque piensan que van a usar la misma cantidad.
Sí, lo mismo
y
que
no.
usaban antes y ya no es
Pero
así.
ya no pueden.
Porque su cuerpo llegó de nuevo a la normalidad.
Regresó, bajó la tolerancia.
Yeah.
Han perdido la tolerancia.
Sí,
So
sí.
es súper peligroso.
Super peligroso. So tell us that in English, because I
Yeah,
always
so-
found that very interesting when you did that presentation.
Yeah, so when we talk about opioids, the body gets accustomed. You take 5 milligrams after your knee replacement and it helps and it controls the pain. But after a while, your body gets used to that amount, and now it's going to take 10
Yeah,
milligrams to control the same amount of pain. And so the body keeps building and building and building how much of the substance you need to have that same effect. It's the same if you're using an illegal drug for a high, you're going to need more and more to get that high. And at some point, you're going to need to just take some so you stay out of withdrawal. But then if you get into treatment or recovery, or you get incarcerated, for example, and you don't have that substance, your body doesn't stay with this high level of tolerance. It comes back down to whatever your normal baseline would have been. But then if someone is released from prison and now they have an even harder time getting housing or employment, you go back to the same friends or the social environment and something happens, it always does, life happens to all of us,
Right.
then if you don't have a better way of dealing with stress and your trauma, and you go back to using, most people use the same amount they used last time, which would be a much higher amount than their body can tolerate. So that's why people coming out of prison are at super high risk of an overdose, of a fatal overdose, if they go back to using.
Yeah, yeah. I always found that fascinating, right? Because you don't think about those things.
but they're
and I know people,
physical changes
and I know
in your
peop-
body
Yeah,
and
and
your
I know
brain.
people talk about, when you're in recovery places, people and things, right? The places where you used to go to, you may not be able to go to anymore
gonna
because
trigger.
it's going to trigger. The people you used to hang out with, you can't hang out with anymore
need to
because
change
it
that.
might trigger. The places the things you used to do, you can't do anymore because,
I mean, that's
so
the same. It's
yeah.
the same for my patients that are trying to quit smoking. Right?
Yeah,
If I
yeah.
take my first cigarette with my cup of coffee at the breakfast table, well, you know what? You might need to take your breakfast in the living room.
Right.
Because if I sit in that same spot,
Yeah.
my body's going to want to do that thing it
Yeah.
always did, which is
Yeah.
light up a cigarette. Right?
Right.
So you do have to make some changes.
Yeah, which is sometimes hard for folks,
very hard.
right?
Yeah.
Especially if you don't have a good support system, if you
Correct.
don't have families and friends backing you
Yeah,
up.
and if you've burned all those bridges
Yeah.
because you were in withdrawal and you just needed, so you
Yeah.
stole from everybody and their
Yeah,
mama,
yeah.
that can make it really,
yeah,
really hard.
Yeah, I think
Yeah.
the stigma of it, is a big, and I just happened to interview someone. We were talking about stigma when it came to smoking, right? And I realized how much stigma I had towards my own daughters, right? Because they're the only ones still that kind of smoke within my family, and I'm like, oh, here we'll be at dinner, and they're the first two to get up to go smoke, and say, oh, here they go, here goes these two, or I'll hear other people say, oh, I'm glad I don't have that problem anymore, and I'm thinking, oh my God, I need to stop doing that because I'm really creating this negative. Or when I'm driving with my daughter, which I love her and appreciate her so much to drive me everywhere when I need to go shopping, but when she wants to smoke a cigarette in the car, I'm like, now I got to open the window, and I'm going to smell like cigarettes, and so I have to be better at that because you don't realize how much stigma you put on folks,
Sure.
right, that don't help them overcome.
Right.
And sometimes, they need that loving and caring type of nurturing in order to get over that one hump.
And it's hard to know how to do
Yeah.
that when you talk about opioids, right?
Yeah.
Because if it is your child, your grown child
Yeah,
who
yeah.
is using,
Yeah.
it's very natural to not want them to be out in the street and God forbid, like getting
Yeah.
trafficked or who knows. But do I allow them to continue to use in my home? And that's when, the help of a counselor
Yeah.
can be really, really helpful
Yeah.
because these are not easy situations and it's not cookie cutter the same for everyone.
Yeah, definitely. Anything else you want to add before we close out?
I just do want folks to know there is hope, right? For the individual and for our community as a whole. We can do hard things when we all work together. We
Right.
got through the COVID pandemic and that was horrible, right? And it was hard and there were definitely things we could have done better, but when we all work together, we can do hard things. And so
Yeah.
we can get folks the help that they need. We can prevent more and more folks from ever using. And so I appreciate you and your journey and your insight into your own, maybe some biases, and all of us have them.
Yes.
And the first step is always, let me just look inside myself and deal with my own stuff so that then I can show up positively for other people.
Yeah, and that's important, right? That's really important. Any words in Spanish that you want to end?
Bueno, primeramente le doy las gracias por tenerme y tener esta conversación, pero yo quisiera dejar a sus oyentes con la esperanza, que la recuperación es posible, que todos juntos podemos hacer cosas difíciles, como bregar con la pandemia durante COVID, y podemos ayudar, prevenir a que más personas desarrollen el trastorno de uso de sustancias, y también podemos dar la esperanza y ayudar a la gente que tiene el trastorno para recuperar físicamente, recuperar sus vidas y las relaciones con sus seres queridos. Sí. Es posible, es difícil, pero juntos podemos hacer.
Sí. Y personas como yo, ¿verdad? Que en algún momento de mi vida tenía tanta negatividad sobre los que usan y lo que estaban pasando en mi vecindario, pero me tuve que dar cuenta de que no era la mejor manera de ayudarlos a ellos.
Y cada uno de nosotros tenemos nuestros prejuicios, y el primer paso es reconocerlo y bregar con lo interior para poder entonces ayudar a los demás.
Claro. Mari, gracias por estar con nosotros en el
Siempre
día de
un
hoy.
placer.
Sí, igualmente me hacía falta, hacía tiempo que no conversaba contigo. Me gusta terminar el programa preguntando si hay una frase, un refrán que escuchabas cuando te criabas que todavía pertenece contigo en el día de hoy.
Y que todavía mi papá me lo dice, que es trabaja fuerte y ora fuerte igual. Uno tiene que poner de su parte y entonces dejar lo demás para que el Señor lo haga.
Claro. Yep. I know we didn't really converse with you, but I know you've been listening, and I just wanted to ask if you had a phrase or a saying that you grew up with that still resonates with you today.
I think it was my father always said, if something's worth doing, it's always worth doing well.
Yes, I like that. Yeah. Well, good luck to the both of you, right? You with your community engagement and you in your new position. Let us know, like, when you guys start going into these schools and how that turns out, and maybe some of the results of that. It'll be important for our community to know. I don't know who you connected with already, but we also have a lot of charter schools out there too that may benefit from these services. So, hopefully, you guys can make all those different connections. Because I think prevention in this case is one of the best things that we could possibly do, especially for our young ones, so that they never get to that point, right?
Agreed.
But still support those that are going through it, and I always pray for them, even if I don't know them. I still pray for them, that God gives them wisdom to be able to change those things in their lives. And I'm so glad that the county is really looking into this, and you always had, but really putting it in the forefront and doing that prevention part is really important. So thank you both for being with us today. Gracias a todos por acompañarnos en esta mañana. Lo esperamos el próximo sábado de 10 a 11 de la mañana en Poder 97.1 FM, la única estación radial latina con dueños y operados por latinos, por la comunidad, para la comunidad. Esto ha sido su hora informativa, trayendo la información importante que nos inspira a una mejor calidad de vida. Que pasen una linda semana. Hasta la próxima, mi gente.